Hello, my name is Chris Childers. Welcome to my Health 2010 Healthcare US Compare and Contrast presentation of the US and UK healthcare systems. We'll start out the presentation with a brief CNN video summarizing the UK healthcare system.
Are we ready on the back table?
At King's College Hospital in London, Dr. Nigel Heaton performs a liver transplant surgery with a live donor. A young man is giving part of his liver to his younger brother.
So that's the piece of liver we're just taking out here. We're just going to flush it down.
The liver is cut in half, with one part for the younger brother and the other part staying in the donor.
The liver is a remarkable organ in that it's made up of 8 segments, so you can take pieces of the liver and it'll function perfectly well.
This transplant costs tens of thousands of dollars. But under Britain's National Health Service, or NHS, the patient doesn't pay a thing.
When patients come to us, we only evaluate them from the point of view of their need. Do they need a liver transplant? The cost never comes into it. As a surgeon, I love that because it means the focus is on the care that I can deliver.
Nobody pays a doctor's bill on the NHS. People will go their entire life without paying a single upfront cost. Hello, Smart.
Dr. Claire Gerarda is the chair of Britain's Royal College of General Practitioners.
Our health service is fair. It means that irrespective of what you can afford, irrespective of your illness, you will be able to access healthcare.
137,000 people died over 7 years because they were uninsured. Of course, the Brits do pay for their healthcare in another way, with taxes. The sales tax is a whopping 20%, and income taxes are as high as 50%. All of that money feeds a healthcare behemoth. The NHS is Europe's largest employer, with well over 1 million people on the payroll. So you'd think it would be inefficient.
That seems sensible, right? The private sector can do things more efficiently. It doesn't work in healthcare.
T.R. Reid, a former overseas bureau chief with the Washington Post, toured the world's healthcare systems for his recent book, The Healing of America.
The least efficient payers in the world are the American private insurance companies. They have administrative costs of 20 to 30%. That's a 30% tax on every dollar you spend on healthcare. Britain is totally socialized medicine, administrative costs 5%. Canada is private doctors and public payers, 6% administrative costs. So it turns out in healthcare, governments are doing this more efficiently than our private sector.
Here's an introduction to some facts about the US and UK healthcare systems. The US healthcare system includes such institutions as Johns Hopkins Hospital and Mayo Clinic. The system is primarily overseen by the U.S. Department of Health and Human Services and the Centers for Medicare and Medicaid Services. Here are some general features of the U.S. system. It's a hybrid system. Publicly funded services are only available to a select few, and the system is financed from a variety of sources. The UK healthcare system includes such institutions as the Queen Elizabeth Hospital in Birmingham, the Norfolk and Norwich University Hospital, and the system is primarily overseen by the UK Department of Health. Here's some general features of the UK system. It's a completely public socialized system. It's funded solely through taxation. It's called the National Health Service. Some additional features of the U.S. system. It's ranked last overall when compared to 10 industrialized nations in a 2014 study. The U.S. spent $8,508 per capita on healthcare in 2011. And it's a multi-payer system with a complicated governing structure. The UK healthcare system, on the other hand, ranked first overall when compared to 10 industrialized nations in a 2014 study. The UK spent $3,405 per capita on healthcare in 2011, and it is a single-payer system with a centrally governed structure. Now let's compare access. Uninsured rate is a good indicator of access, as uninsured are much less likely to seek care. Rural Americans are especially likely to be uninsured. The homeless in the U.S. are also likely to have access issues due to administrative hassles, clinic location issues, or related out-of-pocket costs. The UK has no citizens uninsured. The U.S. has an uninsured rate of 11.9%, or about 38 million Americans. Cost-related access issues. The UK system does not cover dental care, and they require a co-payment of about $11.50 for each quantity of medicine. Cost-related issues in the U.S. cause millions of Americans to seek care inappropriately in the ER. In a 2014 Commonwealth Fund report, 37% of Americans reported having cost-related access issues, whereas only 4% of UK citizens reported the same. Efficiency. The percent of a nation's economic output is a good indicator of efficiency. The more efficient a healthcare system is, the fewer dollars are wasted. The U.S. spends 17.9% of their gross domestic product on healthcare, whereas the UK spends 9.4% of their gross domestic product on healthcare. Inappropriate ER visits are also a good indicator of efficiency, as there is a high potential for waste if common conditions are treated at the ER. The UK goes as far to post signs similar to this in ER waiting rooms, reminding patients and visitors not to visit the ER for a cold or flu. Patients are strongly encouraged to use the appropriate level of care. ERs become congested and inefficient when people use the ER for the inappropriate level of care or due to cost-related access concerns. In a 2014 Commonwealth Fund report, 40% of U.S. citizens reported using the ER for a non-emergency related issue, whereas only 16% of citizens reported this in the UK. Another key indicator of efficiency is the daily time burden for doctors related to administrative tasks. The U.S. has only recently begun requiring providers to meaningfully use electronic health records. There is still a lot of frustration as the U.S. adapts to these systems. The U.S. multi-payer system results in a lot of paperwork for U.S. healthcare employees. In a 2014 Commonwealth Fund report, 51% of U.S. doctors reported a negative impact on time with administrative tasks, compared to 17% of UK doctors. Administrative tasks take doctors away from patients. Administrative costs also detract from resources for patients and make the system less efficient. In the U.S., the multi-payer system creates an immense administrative burden, resulting in higher overall costs for administration of the system and by distracting employees and providers with additional administrative tasks that take time away from patients. Private financing in the U.S. takes many forms. In the UK, there is essentially only one source of payment, the government. In the U.S., administrative costs account for 7.1% of healthcare costs, whereas in the UK, they only account for 3.4% of the overall costs. Another measure of healthcare system is the value of the system, or said in another way, what do you get for your money? Cost per capita is how many healthcare dollars are spent per person in the population. In the U.S., $8,508 are spent per person annually, yet in the UK only $3,405 are spent per person. When you compare this to the overall 2014 Commonwealth Fund ranking of 11 industrialized nations, you begin to see that the UK is getting more performance out of their system with less cost per person. So you could say that the UK system is a more cost-effective or is a better value to the consumer. One area where the two systems are more similar is in delivery of long-term care. First, we'll look at the general description of the US long-term care system. The US uses a means-tested formula, meaning citizens must qualify at a certain income or need level for services. Some of the US modes of delivery include skilled nursing care, nursing homes, assisted living, and home care. Funding includes payroll taxes, income taxes, and Medicare premiums. Unlike the UK, seniors in the US have health care covered by Medicare, which is not complete health care coverage and can result in a high out-of-pocket cost. The UK long-term care system is very similar. They also use a means-tested formula for public assistance. Their modes of delivery are similar, including residential care homes, nursing homes, and long-stay hospital provision. Their funding is also similar and comes from central and local taxation and user charges. Where the UK is different is in their basic health care. Seniors have much stronger health care coverage in the UK with very little risk for devastating clinic or hospital bills or out-of-pocket expenses. There are a few areas where the US actually does better than the UK. The US provides more reminders for preventative care. Doctors are more likely to encourage exercise or mention other healthy living tips. The US has also done a good job of managing hospital-acquired infections, such as MRSA. US patients receive better discharge planning. And discharge plans are communicated better with primary care. Patients are also given better instructions after discharge. Treatment is conducted faster after initial diagnosis, and wait time for specialists are faster. There's also fewer readmissions or complications after discharge. So in conclusion, the US scored last among 10 similar economically developed countries and costs the most by far. The UK scored first and has the second lowest cost. The US has been improving in many areas and beats the UK in a few areas, such as wait times for specialists. Based on the information you have seen, which system would you choose? Thank you for viewing my presentation.